Okay, we're back for the last segment of the show, and I really do appreciate the questions that people are calling in. They're quite good, and they spark some interesting topics that normally I probably wouldn't bring up on the show, but are happy to talk about with that. So if you have any further questions, please do feel free to call that in 727-8750 with those questions, and hopefully I'll have an answer for you. Okay, so let's go back to that blood type slide, and we'll go through those quick things again. And I guess what I was trying to bring up with blood type is it's important what you have in blood type. And let's see, we have caller David on the phone. David.
David Lancaster here, Dr. Reiner. My question is this. I'm a firm believer in colloidal silver.
Okay, good.
And I understand that colloidal silver is wherever there's an injury, stem cells begin to produce. Now, I had called you just a few minutes ago regarding a stroke, and you mentioned that tissue had been destroyed in the brain. Now, if that tissue, having said that, with the colloidal silver present near the injury, would not the stem cells regenerate that tissue that had been injured?
Well, that's a very good question, and I don't know a lot about stem cell technology, but my understanding of the nervous system is, the central nervous system is that there is no regenerating properties within that. But you raise a very good point, and colloidal silver has a lot of undocumented properties and results. I can only tell you from my own personal experience in taking colloidal silver when I got a cold and a flu type illness, that I really doubled up on that and noticed that in combination with Sambucol and a few other agents, echinacea, that the cold was very minimal and very minimal symptoms. So I became a firm believer in it for that particular reason. As far as stem cell, like I said, I really couldn't answer that particular question. I know there's a lot of research going on in stem cells. I know there's a lot of people out there who will maybe take advantage of people looking for injections of stem cells. I had one patient who went down to Mexico, got some injections, but there's no way to know whether they got stem cells or not. So very good question, and I don't know that anybody's going to do that type of study to be able to figure that out. And then the problem with giving someone enough, I would think if you had any, and I'm just guessing at this, that if you had someone who had a stroke and could give them a lot of colloidal silver to try and generate, help to stave the cells and do something along that nature, but you have to be careful of turning that person into a bluish hue. And they actually, I was here at the station and they reran this segment of Dr. Oz with Oprah, where they brought on a gentleman who was drinking a ton of colloidal silver and was very, very blue. He had this, it was almost a dark blue silver color. He was a very interesting gentleman on the show. But I do believe colloidal silver is very important in preventing viral attachment to tissues. So therefore, it had a lot of properties I was interested in when the Ebola scare was around, and as well as when it does for colds and flus. So, okay, I hope that answered your question the best of my ability. Going back to the blood type, if we could bring that slide back up. We would want to go back to looking at, again, the type of Rh factor and the type of red cell type you have will determine what you can give to somebody and what you can receive. And understand that if you're A positive, you basically have antibodies to B, so you can't receive anybody blood that has B, and you can receive any positive A or O negative blood. So you can look down that list and see that the AB positive person can receive blood from anybody because they have no antibodies to the other blood types. So you're always opposite in antibodies. So if you're negative, you have an antibody to positive. If you are B, you have a antibody to A, and you have an antibody to positive blood if you're B negative. So if you look down in the middle and you see B negative, they can get blood basically from any O negative or any B negative. Why? Because they have the B and they have no RH positive on there. So it's an opposite issue. You're opposite whatever you are, and I hope you can look at O negative, and basically it's the universal donor, and AB is the universal recipient. O blood has no markers for A, it has no markers for B, and it has no RH positive, no RH factor. So you can give it to anybody because their body can't react to it. Even though I have an antibody in my blood to the opposite, there is nothing on the red cell to attach to. So I hope that helps to clarify a little bit of that, and we'll leave the slide up for just another minute in case you're making sense of it, and then we'll go from there. Oh, Ray, you're on the phone.
Yeah, welcome back. I was watching from the very beginning, and I says he's going to show up, and certainly you did. I appreciate it, and thanks for showing this blood type because it's very interesting.
Yeah.
You know, I'm into this kind of stuff because you know, different family matters and things like that. My questions are, first of all, my friend who had the gout, he got high blood pressure pills about 2 weeks before he got it. Is that what you call it, a water pill that might have precipitated or caused this? Because 2 weeks before the doctor put him on, he started taking it, he got the gout. And the second question I got, Doc, is C. difficile. It was on the news today about you know, some kind of intestinal problem with it. If you could maybe just touch on that. I know you only have a few minutes.
Sure. Yeah, those are all good questions. As far as the gout, yes, most likely one of the medications or the combination medication he had was a water pill. That would be my inclination that started the gout for Louis, and that would have been basically it caused him to reabsorb uric acid, and that built up his concentration, and it came out of solution and deposited a crystal in a joint, became very tender. So he'll have to go to his doctor and get that rearranged or get a medicine changed, because that's a horrible thing to have happen. C. difficile is a colonic bacteria that we select for by giving someone antibiotics. Remember, whenever we give someone antibiotics, we kill good bacteria and we leave bad bacteria behind, or resistant bacteria. C. difficile is an invasive bacteria. It can cause rectal bleeding. It can cause febrile illnesses, and it is a colonic bacteria. So the most common cause for C. difficile colitis, and it is a colitis, meaning it does invade the local colon tissue, and like I say, rectal bleeding can be a problem, high fevers, chills, diarrhea, and the diarrhea is usually very foul smelling, very greenish in color, and it can spread very rapidly through institutionalized homes such as nursing homes or hospitals where patients get a lot of antibiotics and things of that nature. So it's very important, again, if you're taking antibiotics from your doctor, that you get the shortest treatment possible, that you use lactobacillus to help offset and maintain a normal flora in your gut so that you don't get that. One of the antibiotics that was heavily implicated in C. difficile colitis was Cleocin, as an alternative to penicillin allergic patients, but actually the most common bacteria is amoxicillin, and the reason why is it's the most widely prescribed antibiotic. So that being said, anybody and everybody is at risk of developing C. difficile colitis when they get an antibiotic. We don't know who has that bacteria, but if we wipe out all of the good ones, we leave the bad ones behind, and C. difficile is one of those. There are other bacteria that can come as a result of that, invasive E. coli, and other things as we kill staph infections and some things of that nature. But C. difficile can be treated very easily with Flagyl, and usually we can wipe it out pretty quickly. Just recognizing it and also making sure that it is not spreading to any other thing. Great hand washing in institutional areas is of utmost importance, especially if you're giving a caregiver where you're having to provide perinatal care for that person. Wear gloves, and you can reduce the spread of that. And so it shouldn't be a problem, but in some institutions it is. And I hope that answers your question on both of those. And I thank everybody for tuning in to the abbreviated show. I know they tend to run that whatever section they have in there. We'll try and be here next week. We've been getting busier and busier in the office. And so sometimes on Mondays it's, I mean, I try and cut my patients off at 3:30 so I can be here for the show, but we have walk-ins, and you can see sometimes I'm not very good at controlling the flow into the office. So with that being said, if you have any other questions or any concerns, please feel free to jot those down and bring those up on the next show. And we did have a winner for the Soleus Go, and so I'll see if I can't bring that up on the something else to spark your attention on the next show. With that, thank you for tuning in tonight, and we'll hopefully see you here next week. Thank you again.